Hi, friends. My name is Allie. You may recognize me from working on 3 East. And today I'm really excited to share with you my DNP project, which is focusing on increasing the mobility of our patients on One West. So the problem is that there were 13 falls from May to October on One West. And this is over 6 times the specified benchmark set by Magnet. And the elderly population are at an increased risk for falls due to reduced mobility from factors like decreased muscle mass to even polypharmacy. And when mobility is decreased, it can cause things like fear of ambulation and exercise, which further reduces these patients' ability to move freely. The proposed practice change is implementing a nurse-led multi-component exercise therapy group. Multi-component exercises are unique in the way that it incorporates multiple factors into one activity. For example, strength, aerobic, and balance components within one exercise. And I will also mention the most common examples of multi-component exercises are things like yoga and Tai Chi. So how will we implement this on One West? It's going to be a 12-week trial, and a nurse will be scheduled on the daily grid to conduct the multi-component exercises, and it'll be done 3 days a week for 30 minutes, Monday, Wednesday, and Friday. And a multi-component exercise binder will be provided to structure these groups and to encourage the One West patients to continue these exercises after they leave our care. They'll be given an educational paper at discharge. Now, to measure if these exercises actually help increase the mobility of these patients so that their risk for falls is reduced, the RL system will be used to track the amount of falls that occur during this 12-week program. And the previous 12 weeks before the project will then be used to compare to see if there's a reduction in falls. And attendance will also be tracked to see if the patients actually enjoy this group. This right here is an example of what the attendance sheet will look like. Safety is also going to be a #1 priority for this project. We are going to make sure that the space is clear of clutter before we start exercise group. The nurse is going to ensure that patients have their mobility devices before group starts. And also just reminding patients that these exercises are highly beneficial even if they're not doing the full exercise and they're doing it just to their capability. The findings for this project are then going to be presented at the unit practice council. And we're hoping a 30% reduction in falls and fall injuries, as well as a substantial group attendance. Now, for this portion, I figured I would just give a demonstration of what these exercises will look like while the nurses are helping the patients do them. So the first example is commencing form. So while the first step indicates that the patient should stand, They can also sit, just like I am. And they can go to the next step, which is having their arms relaxed to their sides, breathing in, and raising their arms to the most comfortable level that they can, and then breathing out and lowering their arms again. Next is the broadening chest exercise, where they can begin by breathing in for 4 seconds, raising their arms to a comfortable height, and having those arms be open like they're giving somebody a hug. Then breathe out for 4 seconds. And then bringing arms slowly back down to their sides while continuing to breathe out. The next exercise is the side to side, which begins with breathing and lifting the right arm overhead with the elbow bent and shifting their weight through to the center, and continue breathing in, shifting weight to the left arm with the elbow bent as the next step, going just right to the next side. Please email me with any questions about this project that you have. Right here is my information and my references. Thank you guys. Bye.